I'm so glad you came. I'm here to introduce you to a lovely lady and a friend. Her name is Dr. Donna Wayner. She is the former president and CEO of Hear Again, Inc., and the former director of the Hearing Center at the Albany Medical Center Hospital in Albany, New York. She has served as an associate clinical professor of surgery at the Albany Medical Center, adjunct professor at the College of St. Rose, and consultant to the Deafness Research Foundation and various organizations and agencies. She is the founder and professional advisor of Hearing Loss Association of America, formerly HEAR, Hearing Endeavor for the Albany region, a self-help group for people with hearing impairment in the Capital District. In addition, she has served as professional advisor to the New York State Association of Hearing Loss Association of America, and she is here today with us, and I'm sure that you're going to enjoy hearing her and the other advisors who are going to speak. Thank you. Donna?
We have to do a little dance on this podium. So one moves one way and one moves the other type of thing. Thank you, Mary Kate, for the introduction. And first, what I would like to say is my compliments to the planners and the organizers of this New York State Hearing Loss Association of America conference here in Glens Falls. I think it's an extraordinary effort that you've made and a huge task to take on. But I'm sure that it would make Rocky Stone very, very proud that his thinking and his planning more than 40 years ago is continuing and providing help to the people who need help with hearing problems. I don't really need to tell you all that having a hearing loss is stressful and that it affects daily activities for those living with it, the person with the hearing loss, as well as their significant other. It can drain energy and leave individuals feeling irritable, exhausted, and even sometimes physically ill. It influences all aspects of life, impacting a person psychologically, socially, educationally, emotionally, and depending upon the age of onset, vocationally. Now, psychologically, it can result in emotional difficulties. One's self-image can be impacted, resulting in poor self-esteem. Socially, it can result in isolation or feelings of not being part of the mainstream of life. Having communication difficulties impacts a person's ability to participate in social gatherings, watching television, movies, sports events, theater, concerts, and religious experiences. I don't need to be telling you all this, but I think it's important to consider the fact that as it impacts you, it also impacts all those with whom you interact or you speak with, or your family members, your spouse or partner. There can be feelings of disconnectedness to family and friends, and as well as the environment, resulting in a reduced awareness of warning signs. Educationally, it can result in a multitude of linguistic confusions and learning difficulties in school and world events. And vocationally, it can result in professional peer misunderstandings and possibly reduced job performance because of confusions and even underemployment. Living with a hearing loss has social and emotional issues for the person with the diminished hearing ability, as well as the communication partner. For a person who has a hearing loss, there can be feelings of withdrawal. It's better not to get involved than to have so much trouble hearing, or guilt for making their special needs known, or for feeling themselves a burden, or feelings of self-pity. Poor me, it's just not worth trying. Or anger towards others for not trying harder or forgetting to speak directly toward me, for not being included in conversations, and toward oneself for feelings of ineptitude. Another factor is impatience with others for not taking the time to speak clearly, facing me, speaking slowly, one person at a time, without a hand in front of the mouth. Anxiety, will I appear stupid for not understanding? Will I again not comprehend and appear confused, leading to feelings of loss of confidence, self-esteem, and frustration because I just cannot understand? For the communication partner, the family member, the spouse, a significant other or friend, there are indeed simultaneous feelings of frustration, anxiety, discomfort, impatience, anger, pity, guilt, and withdrawal, because it works both ways. And I think that's very important for families to understand, that this is not a problem just with the person with the reduced hearing acuity, but rather it has snowballing effects with others, especially in the family. There are guilty feelings because one's patient wears thin from frequently having to repeat, and angry thoughts. What's expected of me? Do I have to repeat again? I just can't make myself understood. I just don't know what to do to make myself communicate more effectively. I feel awkward and often ignored when I try to speak. Eventually, I'm just not going to bother. I'm just going to withdraw from trying to speak. That then results in a reduction in communication connections that can result in confusion and loneliness. Living with a hearing loss is not for sissies. You have to get up and go and be determined and very tough to carry on. So I commend you all for being here to learn of these things and learn what things that you can do to make your life better. Doing something about these issues is what you're really here right now at this conference about. You're learning how to better cope with hearing loss and gaining knowledge that will allow you to communicatively function more effectively and efficiently. By learning about the advancements in hearing assistance technology and practicing communication strategies, you're doing a good deal to help yourself and your family. Today, the other members of our audiology panel will further review the impact of living with hearing impairment, plus share tech information that will, we hope, help each one of you to hear and function more efficiently. Our panel today includes Drs. Cara Bedore, Dr. Angela Lala, and sitting down here, Dr. Debbie Trees. The two folks here on my right are from the North Country, we call it, and Debbie and I are from the South area of the Capital Region. Dr. Cara Bedore will be our first speaker, and she has been practicing audiology since 1996 after graduating from SUNY Plattsburgh. Her experience began with an internship at the Stratton VA Hospital, and she has worked in private practices since in Troy, Saratoga Springs, and Glens Falls. In 2020, Dr. Bedore moved to the Center for Better Hearing in Queensbury, New York, where she and her colleagues provide exceptional personalized patient care. Dr. Bedore specializes in diagnosing and remediating hearing losses for all ages, and she's going to speak to us today about the influence of hearing impairment on health. So, Dr. Bedore.
Where do I aim?
First time up here. Okay.
Let me just get it.
Nope.
Here. Don't touch it.
Just had to wake it up.
Okay. All righty. Why, thank you. All righty. Thank you all for coming out today. What a great event that was planned. Donna touched on, Dr. Wayner touched on many, I don't know, this screen's doing something different than that screen. Oh, thank you. I won't look over there. It confuses me. So I'm going to look over here.
So there are many different aspects everyone's talking about these days on how hearing loss can affect your health related situations. There's 40 million Americans affected, and lifestyles change and affect your hearing also. But your hearing these days, people are talking about how hearing loss affects other portions. Sorry. Can we keep talking? I can keep talking. I'm not quite sure. No, that's okay. That's okay. I'm not technologically advanced. I can do my computer programming with hearing aids, and that's about it. The other things, my teenagers take my cell phone and I frustrate them. So, but things that everyone are talking about, the big thing that everyone's talking about is the connection to dementia and hearing loss. Your memory, the effects can be, you can become a fall risk, you can fatigue easier, diabetes, hypertension. There's so many things that people say, how can hearing loss be affected or your health be affected by your hearing loss? If with depression, as Dr. Wayner had touched on, if you have not, if you withdraw socially, then you are not going to have as much interaction. And if you withdraw socially and stay home, a lot of times people won't be as active and moving. So you become a little bit weak, and you may not be, depending on how good you are on your feet to begin with. That is how people can become a fall risk from the connection to hearing loss. One of the other, heart disease, a lot of times with hypertension, hypertension can cause that. There is enough research to absolutely say that hypertension can, and diabetes can cause hearing loss because in the changes of your blood vessels. But also with the withdrawal of being socially not active and maybe having some anxiety or depression with it, can cause you to have a little bit more hypertension to begin with, just from anxiety and depression. Some other things, when your memory, a lot of times we'll say to people, how many times have you said to your husband or your wife or another person, you know, we talked about that. If you can hear the conversation better and you process it better, then your brain is able to store things better. If you come out of a conversation and you store your conversation under a certain subject that you thought you were talking about, and it might be 1 or 2 words off, then other people, then they come back and you can't recall that situation. So, so I'm sorry, I don't know what's going on up here. So it's a little distracting to me. So I feel like I'm stuttering. So it's okay. I don't think it has anything to do with that, but we'll see. So there are a lot of connections to your hearing and your health. And I find that if I hear things correctly, then my recall is much better and my memory is better. So, so of course we all want to have a better memory. Let's see, is it not switching? All right. No. Okay, well, I can just talk about it the other way. It's not moving. A lot of times people, there's also some factors that that can help us It is? Okay. Thank you, Debbie. Modifiable. So the risk factors. So there's some things that we can change. We cannot change our genetics, not yet anyway. And then there's modifiable factors. The modifiable factors, and this doesn't have to just do with diabetes. It can do, or with dementia, but it can do with diabetes, hypertension, all those other factors that are involved with your health and hearing loss. And if you address the modifiable factors, we can live a much better lifestyle with hearing loss, with diabetes, with dementia. A lot of these factors include being proactive. So a lot of times, I know it takes on average about 7 years from the time that we identify hearing loss until someone says, yeah, maybe it's time for me to do something. And I'm sure everybody's numbers are different. I know it takes a lot of convincing. Sometimes I've had people come in and say, oh, my daughter told me that one of her friends ran into you and she thought that you had dementia. And let me tell you, that person couldn't put hearing aids in their ears fast enough. So, but fixing your hearing loss, maybe not fixing it, but assisting your hearing loss to the best of the ability can help to decrease the anxiety and depression. It can help with your memory and your recall. So that is a lot of the things that we can do. Very similar to diabetes. Diabetes, if you manage it correctly, if you eat correctly, and you exercise and try not to gain weight, which is all of those wonderful things, but those are identifiable and those can be managed. So if you, as you all are aware, you put your hearing aids in and you go and you do the best you can and you use all your coping strategies and you use your telecoil and your looping and your assistive devices, then you're going to get much better access to speech and be able to interact with people more consistently. All right. And so the modifiable causes later in life, we're going to skip that. They have all these factors that can kind of come in together. I think we're all going to overlay each other as far as our talks, but how your education and how your health in general comes together. And I'm not going to talk about reduced brain inflammation because I have absolutely no input on that because that's so out of my realm of input. So we all know that hearing and takes a lot of effort. If you put in the effort to have the best hearing you can with your devices, whether it's surgical correction, communication strategies, it will definitely help to reduce stress, which of course helps every other aspect of your life. And if we could reduce stress completely, then I want to know how you do it. And then we'll all be rich and in La La Land. So thank you. I apologize for the technical difficulties.
We thank you very
Yes,
much.
thanks, Donna.
And there's
Nope, let me give you that.
There will be time for questions afterwards. Second in our array of speakers. Now, here we have someone doing something magical. I can go ahead. I can go ahead. Mhm. Okay. Well, we'll wait just a second. We'll wait a second. Here we are. Good.
I just want to point out that technology assistance is being rendered by the person who also printed the program. Designed it.
Mary Kate just said that the person who's doing the technological work the miracles you're seeing in front of you is the person who also designed and arranged for the printing of the program. So that's wonderful.
Yes.
Good. Now, our next speaker is Dr. Angela Lalla, and she brings over 30 years of experience in the field of audiology, including 12 years working at a local hospital and many years as a marketing and training specialist for a hearing device manufacturing company. She's originally from Amsterdam, New York, but has lived in the Saratoga Springs area since 1992. Angela holds a Doctor of Audiology degree from Salus University and has also attended SUNY Plattsburgh and SUNY Geneseo. Her topic today is an update on hearing aids and Bluetooth. Angela. And I will mention before Angela speaks that we'll be open to questions after we finish our presentations.
Okay, we're going to hope that the material, everything works, but there's nothing on these slides that are critical to what we're going to talk about. So when I say connecting to the outside world, what I mean is the difference. Your hearing aids help you connect to the person in front of you, the people next to you, but it's through assistive technology and through use of your cell phone, those types of things that you can connect beyond the individual in front of you. So let's see. Okay, so the things I'm going to go over are just some general things you may or may not be aware of. One of them is Bluetooth, and that has to do with primarily cell phones, but some other things. We're going to talk about telecoils, assistive technology, and then at the end, I want to talk about just some general kind of takeaways to this. So, what is Bluetooth? Bluetooth, the word Bluetooth is actually a name, a person's name. That's why if you ever see it written, it's going to have a capital B. Bluetooth was named, it's because of a guy named King Harold. He was a Danish king in the 900s. And what he's known for is bringing the tribes of the area together into one cohesive group. So when they were developing this technology, they used the term Bluetooth because this king had bluish gray teeth. Okay, why? One thing says he had probably dead teeth that had turned gray. Another thing I read said that he liked blueberries. So either way, he became known as, you know, Bluetooth. So when this term Bluetooth became used to refer to this wireless technology, they did it because the technology is designed to bring devices together. So that's where the term Bluetooth was developed. The symbol of it is actually the rune, the letters that they used at that time for Harold and for Bluetooth. So that's why you have that little thing. So let's talk about hearing. Cell phones and Bluetooth. How many of you use a cell phone, a smartphone? Okay, most of you do. Are any of you using Bluetooth with your phones? Wonderful. It's a great tool. It's not the main reason to have a hearing aid, but it's certainly a nice addition to a hearing aid. Bluetooth can be done two ways. So there's something called Bluetooth low energy, which is a very efficient use of the energy of your hearing aid battery and your cell phone. And then there's Bluetooth, regular Bluetooth. How many of you have an iPhone? Okay, you're all, yeah. So iPhone uses Bluetooth low energy. And a lot of manufacturers built their Bluetooth technology on the premise of using Bluetooth LE, and because of that, iPhones were the first first cell phones to become hearing aid compatible. The good news is, well, you couldn't use Bluetooth with an Android phone. So if you had an Android phone, you might be able to have a remote control, but you weren't able to actually listen through your hearing aids to what came off of your phone. So finally, they got smart and they developed a kind of a consortium, and they came up with something called the audio sound for hearing aids, audio streaming for hearing aids, or what we refer to as ASHA. And ASHA is now the way that Android hearing aids or Android cell phones can connect to hearing aids. And this is simply a wireless connection that allows you to listen to music, listen to phone calls, audio books, videos, whatever you like through these, through the Bluetooth in your hearing aid. The thing to know about Bluetooth in hearing aids is that you have to make sure you get a hearing aid that does have Bluetooth. Most do. But if you start going into some of the custom and smaller hearing aids, you may not be able to get Bluetooth because of size constraints. So it's important when you're dealing with your hearing care professional that you ask these questions and have that discussion, because it's really important. Okay. Let's see. Oh, this is great. Okay, so another way to connect to the outside world is through manufacturer developed accessories. Those are the things that your hearing aid manufacturer built to work with your particular hearing aid brand. So if you use Oticon, Oticon has created their devices. If you use Signia, they have created their devices. They don't go between manufacturers, so you're dedicated to what they have available. But these assistive devices are wonderful. Some of them are a remote microphone. A remote microphone is a great way to connect your hearing aid to the person you're talking to. In other words, they would wear the microphone and their voices would stream into your hearing aids. This overcomes distance and also especially background noise. So a remote microphone can be very useful. You can pass it around. Some manufacturers actually created microphones that are tabletop versions that will allow you to hear more than one person. Once again, if this is something that's important to you, have that discussion with your audiologist. They make them for televisions. You plug your TV into a device, and no matter where you sit in the room, it's as if you're 6 inches away from your TV. Again, it brings the signal in, it overcomes any noise in the background, and now you're able to hear that program, but also hear the person that you may be watching TV with. Okay, so those are manufacturer type of hearing device or assistive devices. Now, I want to talk about telecoils. How many of you have telecoils? How many of you use your telecoils? Good. Telecoils used to be about the only thing you could do to connect to your telephone because they were landlines. But telecoils also serve other functions. One is as a loop system. So when you look at, I think this room is actually looped. You're sitting in a room and there's a wire around it. You put your hearing aid on T or on MT, and my voice is going into that loop, turning into an electrical signal. Your hearing aid is changing it back to sound. So again, it's as if I'm sitting right next to you. So telecoils are very important for that type of thing. They also make individual telecoil device or assistive devices where you might walk into a place and they give you a neck loop with a little packet that you can adjust the volume. And again, you're allowing yourself to be able to hear that person as if you're having a private conversation with that person. So, you know, those are all things that help you connect to everything else in your world. When you're choosing a hearing aid, telecoils and Bluetooth do not always come standard in your hearing aid. You, again, want to make sure that you have a discussion because while telecoils aren't as useful for telephone listening anymore, because so many people have moved to cell phones and cordless phones, they still serve a very good purpose. Here in Glens Falls, the Charlie Wood Theater is looped. So if you have your telecoil, you may not use it often, but you go to that theater, you just push a button and you're tuned into everything. So again, make sure that you're talking to your audiologist or hearing care professional about these types of situations. Okay. I lost my mouse. Whoops, back. Oh, I don't need the rest of them. Don't worry about it. So those are important devices. There's also devices you can get, like a pocket talker if you know someone who's maybe ill and not using a hearing aid. It would be an important device for them to be able to use with their doctor or caregiver to at least have a one-to-one conversation. You folks are all very savvy because you're here at this meeting, but you may know others who aren't, and you can really assist them in their hearing journey. You know, when you go and get a cell phone, last thing I want to talk about, when you get there, talk to the people that are going to sell you their phone, that phone, and ask if you can connect it to your hearing aids to make sure it works. Because not every cell phone works with every hearing aid that's available. Your manufacturers put lists on their website. So if you're in the market for a new cell phone, go to the hearing aid manufacturer website. They will give you a list of phones that they have tested and know will work with their hearing devices. So if you have questions, we can talk about them after. I hope this was helpful and gave you a little bit of an idea of what's going on with technology and assistive devices. Thanks.
Thank you very, very much, Angela. That was excellent and very helpful practical information. Now, Dr. Deborah Trees, who is in her private practice, Deborah Trees Audiology Associates, will be our next speaker. And she delivers hearing care in the Capital Region, and she has been doing it for 35 years. She offers hearing testing, counseling, selection, follow-up, and care for hearing solutions. She's one of the professional advisors and on the planning board of the Hearing Loss Association of America, the Albany Capital Region Chapter. She's also the co-author of an online CEU training course for nurses and other health professionals on hearing loss called Focus on Hearing Through Advantage Education. Dr. Trees is a fellow of the American Academy of Audiology and a member of the American Speech Language Hearing Association, as well as the New York State Speech Language Hearing Association and the Capital Area Speech Language and Hearing Association. She's going to update you on cochlear implants. Debbie.
Good afternoon, everyone. Thank you so much for having me here today. Really appreciate it. So when I was trying to decide what I was going to do with the topic of cochlear implants, I know that many of the people that are active in the HLAA arena, many of the people that would be active in your local groups, active in the New York State group, have cochlear implants and already know what is going on with cochlear implants. How can I ask how many people here, by show of hands, have a cochlear implant today? Here. Okay, a few. And so my talk is for all, not just us here, but also for those people that are watching on Zoom and the people that might see this in the future. I'm really interested in having people understand and be able to feel a little more comfortable with the idea of a cochlear implant. And so the cochlea is kind of shaped like a shell. It's the sensory part for hearing. And you can see that beautiful picture right there. And the cochlear implant is a series of electrodes that is placed inside of that shell, basically, of the cochlea. And then there is direct stimulation of the nerve for hearing right through that electrode. And this bypasses getting sound into the ear acoustically. And instead, it stimulates the nerve directly. So that's the basic concept of a cochlear implant. So it's basically, and this is from the National Institute for Deafness and Communication Disorders. It's basically a transmitter. And I don't know if, can you see? I don't have a pointer, but there's a transmitter that is implanted under the skin, and the electrode goes into that cochlea. You can see the snail-like shell right inside there of the inner ear. And the electrode goes around inside. There's different placements, and the surgeon is the person that puts that electrode in. And on the outside of the implant, which is up against the skull, usually underneath the skull layer, is a magnet and a transmitter part. And outside of that is the processor, the speech processor. So there's a couple different parts to that, that whole system. And the processor itself has in a microphone to pick up sound, a way of changing that sound over to electrical signals that then go across the processor into the receiver that's underneath the skull, and then down through the electrode and stimulates the cochlea. So if you look, here is just the processor and the coil that goes over top of the implant that's implanted surgically underneath the skull and underneath the skin. This just happens to be a Cochlear Americas processor, but it could be other. There are other businesses, other manufacturers, other professionals that are working with cochlear implants. And I wanted to show you just a picture of, on the, I would be on your right-hand side, the what that processor or what the implant actually looks like. It's a side view of the implant, and at the very base of it, very bottom of it, is curled just like this, and that's where the electrodes are, and those electrodes are then placed very carefully inside of the cochlea. Other types of processors might be ones like this, which are, this is called the Kanso. It's again Cochlear Americas, but there are other processors, other manufacturers. And this is just placed on top without having anything over the ear. And overall, here's a kind of a picture from the Mayo Clinic. You can see the processors on the outside. The speech processor has a microphone, the transmitter. They are on the ear magnetically, and then sending the signal across through the receiver and the processor, and then into, sorry, hold on, and then into the cochlea through that that electrode. So this is just important for me, just to give you an idea of what that processor is, and for the people that actually don't have a cochlear implant. And the reason I want to kind of give you information about that is because I think it's important to know that there are more people who might be candidates today for a cochlear implant than when this technology was first available. There's now improved outcomes for cochlear implantation, and there's many studies that are showing this. And so in 1984, those first implants were used, and only for people who had severe to profound hearing losses. But now there's over 170,000 people who have received the cochlear implants. But now we're thinking we want to expand that. And today, a person who even has normal hearing in some ranges might be in their audiogram, might be candidates for getting the cochlear implant. But there's several factors that we're looking at: hearing loss, word recognition, speech testing, aided responses. And part of the issue is that these tests are dictated by the FDA and by insurance company requirements. And the insurance coverage and the payer requirements can sometimes stop the process from continuing on for each person. So that we're wondering, how bad is bad enough for you with your hearing aids set to the optimum level? How bad is bad enough for you then to be considered at least for a cochlear implant? So what I want to encourage us is to, begin to talk to your audiologist. If you are having difficulty, even with your hearing aids, set at the best possible optimal level, and talk with the audiologist. We ourselves want to open up our minds as to what is available. And I think that that's an important thing for us to consider. We need to talk to insurance companies to help insurance companies understand that the criteria might be years and years old, just not applicable for today. And I think that's basically at the end of my talk. And I look forward to answering any questions that you might have. Thank you. Thanks.
No, I just heard something, but I don't know what it was. Oh, a phone. Okay. Audiologists are always doing hearing tests. You see, she was just testing to see if I heard it when she dropped her phone. I would like you to think about the fact that if you total the number of years all of us have been audiologists, it's over 150 years, which is truly mind-boggling. And I want to say that I got the highest score because I've been in audiology for 60 years, and I think, can this really be possible, But anyway, thank you very much, Debbie, Cara, and Angela. It was wonderful. I think we covered many different things. We could have spent many, many, many more minutes on everything, but it gives you a little bit of a smorgasbord to think about. And speaking of smorgasbord, it might be time for food for you folks. I'm not sure, but are there any questions that you're pining to answer. Yes, Sue Miller.
Quick question. When people ask about the telecoil and I start to explain it and I say, well, it's like it's a piece of metal and it has wire. What's the metal and what's the wire? What are they composed of?
Come, Angela.
I'm not 100% sure, but I think it's copper wire in the thing. And then remember the old phones? You could unscrew the top. And I don't know, when we were kids, we always took our phones apart. But if you took it apart, there was a thing in there and there was a coil in there that you may or may not have seen. But that coil is, so the sound is coming into the hearing aid. The hearing aid, instead of amplifying it as sound, it's amplifying it as an electrical signal. And then the phone is creating that signal, and then the hearing aid is changing that signal back into sound. It's copper. It's copper wire. Oh, it's called a magnetic induction loop. We think it's a magnet. It's been a long time since grad school. But it's the wire that is changing that sound. And it's copper. Okay, great.
Thank you. Before you leave, we're going to give you an exam on that. So think about it. Yes, we have a question here.
Hi, Donna.
Hi.
It's Melanie. I don't know if you remember.
I
me.
remember you, Melanie.
Thank you for the first audiologist. You were talking about all the underlying illnesses related to hearing loss. Does that pertain to a person who was born with a hearing loss or who lost their hearing like later in life?
Just come over to the.
So the question was, do the underlying causes, the medical causes, have to do with people who were born with hearing loss or if they acquired hearing loss as they aged? And it's both. So if your hearing loss is addressed, then all of those factors are decreased. It doesn't solve the problems, but if you address the hearing loss, whether it's at birth or soon after, hopefully, or later in life, the sooner it's addressed, the less the hearing loss will contribute to those underlying causes. You're welcome.
Got
We
a
have a
question about the telecoils. I was just shopping for hearing aids and
I'm sorry, I
And,
can't hear you.
audiologist pointed out the top of the line Oticon. Okay, the top of the line Oticon with rechargeable batteries can't have a loop in it. It can't have a telecoil in it, but the battery ones can. And some of the other manufacturers are leaving telecoils out for other technical, physical, whatever reasons. But that's just wrong. The manufacturers think that Bluetooth is the way of the future, and it is. In 20 years, it's going to be. But right now, all the theaters and everything, we got coils around them, and they're not going to put on Bluetooth tomorrow. So,
Okay.
see, we're good. I think both technologies got to be in every hearing aid.
And I agree. And that's why I said, have a conversation with your hearing care professional. I worked for Oticon for 20 years. So I can tell you Oticon hearing aids, the over the ear style, whether it's a RIC or a BTE with tubing, are both equipped with telecoils and Bluetooth. They are both available. Another manufacturer I know of, I think it's Signia, their hearing aids come not standard telecoil, but you have to, the audiologist has to basically replace the shell to give you the telecoil. So they can be available in both, and I think they both should be, and they serve different purposes. So the idea is talk about what's important to you and make sure your questions are being answered. Okay?
Thank you. That's a good answer.
Yeah, I love my telecoils, and I've been distressed to discover friends of mine who've gotten hearing aids and their audiologist never mentioned the possibility of a telecoil to them. And it's great for you to advise us to bring it up with your audiologist, but if the patient doesn't know about it and the audiologist doesn't bring it up, it's, I think, a real problem. And can I just ask a quick question? How many people here went to audiologists who never told them about telecoils? I think that's a big problem.
It is a big problem.
Am I correct that it's also illegal in New York State that our audiologists required to inform customers about at least the possibility?
I don't know.
I had the feeling that was a law.
Do you know? Debbie knows, so Debbie will answer.
That was a great question. In New York State, the regulations for a hearing aid dispenser, whether it's an audiologist or a hearing instrument specialist, are that we now, as of I think in the past couple of years, that we are to include information about telecoils. Sometimes I know for me, I have to have a choice based on size and space, and I do give that choice option to patients. Sometimes patients don't understand what it is, and I'm just trying to get them into at least amplification in the first place, because adding the T-coil option on there can add more bulk to a device. So there's many different considerations that we're going through, but I appreciate your advocacy, and I think that it's an important advocacy. Thank you.
Yes.
I have two questions. The first one is, does anybody know where you could find a list of medications that negatively impact hearing? That's the first question. And the second one is, I've become aware this weekend that there are different educational backgrounds for an audiologist. I thought you were all PhDs, but apparently that's not the case. So how many different types of audiologists are there, and what are their educational backgrounds?
Do the one about the medications.
So I know it's already being, the question was a list of medications that are harmful to your hearing or ototoxic. Wonderful Google can give that to you, but make sure you look at your source. So Google. Also, if you are concerned, a lot of times if you're placed on an ototoxic medication, it's usually because there's something bigger that they're worried about. And so say it's a cancer drug or a very strong antibiotic. If your doctor places you on one of those medications, which can harm your hearing, your doctor should have you monitored. So usually your hearing will be monitored during that time. So yes, and there is a book that you can get, Ototoxic Drugs for Audiology. Yes, yeah. Does someone else want that, or do you want me to go ahead? No, Angela's got the next one.
Okay. So I when I started, audiologists, were master's level degrees. So they went to school for 4 years, and then usually a master's program was 2 more years. Around 1990-ish, they moved to a doctoral level for the profession, meaning you would be an AUD, which is a doctor of clinical practice. There are PhD audiologists that tend to be, not always, but more research developed. And there are still audiologists practicing with a master's degree because as part of that transition, they allowed master's level audiologists to continue to provide services. New kids coming in, though, are doctoral level. Does that answer your question?
Either the AUD or the PhD, the new
Yes.
kids, they're either
Yes.
one of those.
Exactly.
The working doctorate or the research doctorate.
And I know there are PhD audiologists seeing patients, but they have the background to do that. They just took more of a research oriented track in their education. Okay? A hearing instrument specialist is somebody who is not an audiologist and is able to not do diagnostic testing, but able to test for the purposes of fitting a hearing aid. The current guidelines are that they have at least a 2-year degree in something, and then they complete, is it a 2-year program? A 2-year training program with someone who is already licensed as an audiologist or a hearing aid dispenser. And then they have to take a comprehensive examination, and that consists of 2 parts: the written test of the knowledge, and then the practical test of doing a hearing test, examining the ear, and doing an ear impression. Okay.
Any other questions? We have time for, okay.
So I work out in Buffalo with the deaf and hard of hearing community, and I do lead from time to time peer group support and education and helping them communicate with their audiologists. One of the things I noted working with them is they don't know what question to ask their audiologist. So my question to you guys is, would it be helpful for audiologists to create a list of questions for their patients so that they can review them before they come to you? Because I find with cochlear implant patients is they don't know how to describe sound, especially if they're new to it. So sometimes it requires guiding them through the process.
Who would like to answer? The first part about questions.
I'm writing down your suggestion. I don't know. I don't know about you guys, but I don't remember, but it's a great suggestion. And I think that, the more that we can communicate together and talk about what the needs are, that's part of what we're here for, is to understand, okay, how can we make it better for the people that we serve? So writing down that in what I am doing for my practice, will be writing up a list of some questions that I could hand someone. I already have a kind of a routine that I do, and I hope I cover everything, but I might not. So that's great. Thank you.
Stay there for a second. Hello? right over here. It's God speaking to you. Oh, I just want to make I want to make a comment that I believe the National HLAA has such a list. It was out on the table. I picked one up myself.
Great.
So I
okay.
would get that to start with.
Perfect. Thank
Okay,
you so
I don't know about the
much.
cochlear, but for regular hearing aids,
Yes.
you really should
Okay.
make
Thank
sure.
you.
And it's probably online if there's none out there.
I'm sure it is. Thank you. Thank you so much.
I have a very short question.
Here's this another last short
Um,
question.
What's the average life of a cochlear implant?
What's the average life of a
Of a
cochlear
cochlear
implant?
implant?
It depends if we're talking about the interior part or
Yes.
the exterior part. What would
I
you
thought
say?
they lasted for your lifetime, but somehow I picked up here that maybe they don't.
Well, it depends really on so many variables. Debbie, go ahead.
Yeah, I think if there's data that you can look at about cochlear implants and the life of a cochlear implant, and they've lasted for 30 years. I mean, it's a long time. So, I think, plus I'm sure, I mean, I don't have that data right at my fingertips. I would have to go and look it up, but they last for a very long time. It's the processor, the outside piece that needs to be updated and changed. The processors, just like hearing aids, come out every usually 3 to 5. There's always extra new technology that's being added in, and I would say 5 to 7 years. Yeah.
Would you? We all thank you. You're an excellent audience. Your questions were excellent. And I thank Doctors Cara Bedore, Angela Lala, and Deborah Trees. Goodbye. Have a lovely afternoon.